first to thank the organizing committee for the invitation and the opportunity of being here today. And probably the first thing you think about Brazil is Carnival or is soccer. And when you see the faces of our soccer players in Latin America, you can say, thank God they are good at playing soccer, because I don't know how can they do these faces. But we also are proud of having another product in our country that is Agita Sao Paulo. And Agita Sao Paulo is a very well-known program that is in the state of Sao Paulo, and we are talking here about a state of 40 million inhabitants in our region, in the south part of Brazil, in 645 municipalities. And this new perspective, our program has been working with the idea of building health through building healthy behaviors, especially in terms of physical activity in our community. So in this sense, we structure a physical activity intervention program in our region, and this program is coordinated by our research center in São Caetano do Sul, that is a group composed especially by researchers in the physical education and sports medicine field. And we have been working together not only from this non-profit institution, but also with the support of the government of Sao Paulo through the Health State Secretary of the state. We have not only this combination of the non-profit institution and the government side, but we also have a scientific board composed by national and international professionals, and also an executive board that is composed by non-governmental and governmental institutions. And I think this is one of the key factors of our program, this two-hat approach in which we have been working with this private sector, with the government sector, and with the civil society. And we have involved many actors in this activity promotion program in the state. So for this reason, we are able to reach almost all kind of our target communities in terms of children and adolescents, workers, and elderly people that are the main targets of our program. This executive board meeting, we have a monthly meeting. So since 1997, we have a monthly meeting from February to December. So we gather all these partners. At this moment, we have over 400 partners on our program. And in these meetings, we discuss the strategies to promote physical activity in the community. We use the new paradigms in promoting physical activity. So in this sense, we are not only using the terms of the sports as being active, but also the fitness to being active, but mainly we are encouraging our population to practice physical activity as a means of being healthy. And we are not using only sports, because we know very well that sport is not always related to health, and we have very good examples with this, and especially for men, I think we have not only relation with health. But in these communities, we are emphasizing the importance of being physically active, so we are encouraging people to accumulate at least 30 minutes per day of physical activity and at least 5 days per week. And besides that, and considering the scientific information we have nowadays, we are also increasing people to decrease the time you spend sitting. For the reason, probably the next pod meetings will be on a stand. We are not going to have more shares in the next meetings of our network. We are also having a specific target and settings in which we are promoting physical activity. You use the mascot of our program, that is this one, we call the half-hour men. Then we put the half-hour women, just to satisfy women also. And then we create the elderly half-hour men and women. And then we put together even the 15 minutes girl and boy, and even the dog we put in the family to encourage everybody as being physically active as a family. The settings we are promoting physical activity is mainly at work, so we are encouraging people to increase the physical activity they use during the work time and using probably an active transportation, to increase physical activity during the leisure time, especially by doing the physical activities that people got pleasure, and this is very important in our message. And finally, to show people that it's possible to do physical activity even at home. So you can use your household chores to do physical activity. In terms of our community interventions, we have been using a very new model that is the ecological model, and in this sense, we call the mobile management of this ecological model. So we are working at the same time with intervention in intrapersonal factors, not only working with knowledge and behavior and biological aspects of being physically active, but also with social environments. So in this sense, we give all the support from our families, from work site, from the politicians, and everybody in the societies to support these active behaviors. And at the same time, in the physical environment, in terms of natural or constructed environment. We have very nice interventions that we have been doing at the schools. So since 1996, we mobilize all the schools of the state of Sao Paulo, and we are talking here about 6,000 schools, 250,000 teachers, and 6 million students in this program. So the last Friday of August, we involve all the schools of this public system to discuss physical activity in the community. And we are involving not only students and teachers, but also the community to increase this physical activity level. As an impact of these actions, we have seen a better physical activity level of these children and adolescents in the public school system than the private school system. In terms of workplace, we also have been working with large companies like the Petrobras, that is a larger Brazilian company, petroleum company in South America. We have been working with more than 200,000 employees, working in very different sites and in different settings to increase the physical activity level of this population. So we are reaching very different kinds of people on all these years. We also have been doing we also work with the small companies like this, that they are just including the physical activity during the work day. In terms of community interventions, we have been a very nice support of the health sector with the Health State Secretary of Sao Paulo. We are organized in terms of health in 18 regional departments of health. And in all these regional departments of health, we have been doing a capacity building work to reach all the health professionals of the state. So you can see here in the last 2 years, less than 2 years, we reached almost all the state, we crossed all the state to capacity building at least more than 700 professionals in the field of physical activity promotion. We are starting now a distance-based course to reach all these kind of professionals that include not only physicians and nurses, but physical therapists, community agents, and other kind of actors in the community sector. In all these municipalities, we have been done an executive meeting, an executive board. They have been organized as the central coordination of the program. This is the picture we had from 1996 to 2008. And after this mobilization, we increased in 80% the number of municipalities that have been part of Agita Sao Paulo. And all these municipalities has been doing a very nice job, mobilizing the schools, mobilizing the community, and even organizing very creative initiatives like this, like dog walks that they have been organizing in the community. Another good action that we have been working with these communities is to celebrate the World Day of Physical Activity that is celebrated in April the 6th. And it has been possible to mobilize since 2002 thousands and thousands of people around all the municipalities, not only in Brazil, but even in Latin America and other parts of the world. And last but not least, the physical environmental changes that have been doing, not only considering the natural environment, but the constructed environment. In some places, we have very good examples of these municipalities doing changes in the environment, in the sidewalks, creating cycle lines, creating or changing environment like this, before Agita and after Agita, or places like this that were totally transformed to be an active places and invited places to have people involved with physical activity. Some of these municipalities have shown also a decrease in the rate of hospitalization by stroke or diabetes in these communities. And finally, we also have been evaluating our actions, not only in terms of the economic impact of these actions. We have very nice analysis of the cost effectiveness of our program done by the CDC in 2005, but also these results have been published in 2 reports of the World Bank. The last one was published in September 2000. 2011, in which they highlight the results and the impact of Agita Sao Paulo in our community. As we are a research center, we also are concerned about the trends of physical activity of our population, and we have seen a decrease at least in 70% of the tax of sedentarism in the population of the state. So this is a very good example that it's possible to change the physical activity level of this population. So probably you can see at the end, well, how it's possible to do all these things with such a small group of people and almost no funds or little funds to support all these actions. And I would like just to highlight that we are working with this clear message. We are working with very nice partnerships, with a very good balance between sectors, with a low-cost multi-intervention in our community, and making a good capacity building in our program. So probably for this reason, we think that physical activity is for sure the best pill and the best solution we have to prevent, to treat, and to control obesity, and not only obesity, but probably almost all chronic disease. Probably not for having children doing amazing things or women doing amazing things, but for sure for having people living better and happier. Thank you very much for your attention.